Good afternoon and welcome to Health is Wealth. I'm Roberta Robinson and I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today we have Dr. Tom Risser with us, and thank you for coming on board, Dr.
Yes.
Risser. And we're going to talk about a very important subject today, the heart. Now, Dr. Risser, you, along with being a cardiologist at the Cambridge Health Alliance, you have a few other titles.
Well, I direct the cardiac diagnostic laboratory at the hospital,
Okay.
which includes a diverse number of procedures, and I direct the permanent pacemaker service. And in our academic role at Cambridge Health Alliance, I'm an assistant professor of medicine at Harvard Medical School.
Wow, pretty impressive. And you deal with the heart,
I do.
which is incredibly important because without it we do nothing.
I like to think of the heart as the center of the body, but all of my friends believe their organ, whether it be the brain or the kidneys or the lungs, that really are the primary organs.
A little biased there, right?
I think so.
All right. So there are some diseases of the heart that are pretty common, and maybe some of our folks have had them or even know about them. Can you tell us what they are, the most common?
Certainly. Well, I can list the various organs, the various systems of the heart, and what can go wrong with them. So the granddaddy of them all, far and above the leader, is the power, the fuel lines to the heart, the coronary artery circulation. So that's the most common cause of death in America, primarily with cardiac artery troubles, but disease of the arteries to the brain are also involved in stroke, which is another massive source of morbidity and mortality in America. And next along the line would be the...
And if I just stop you,
Yes.
it's that the blood flow, is that the blood flows through the arteries?
They are indeed the
So we
fuel
want to make
lines.
sure the
They-
fuel line. So we want to keep that blood moving, and we
Yes.
have to have something in good order for it to move through.
They bring the gasoline to the engine.
There we go. We understand that.
Right, no gas, no power.
No gas, no power.
So
Right.
the second system of the heart is it has its own electrical system,
Okay.
which is very complex. Many people don't realize that the heart really doesn't need the brain to know to contract. It has its own intrinsic pacemaker that generates a signal, which is then transmitted through very specialized tissues throughout the heart to try to get a synchronous contraction. If one part of the heart is stimulated first and contracts, but the other is not stimulated, it might relax and simply bulge. And so rather than the blood going out the aorta to the system, it might simply go to and fro. So we need a very specialized conduction system of the heart to cause all of the walls to contract synchronously. So
Sounds complicated.
it is. It can be very difficult because duplicating Mother Nature in her wisdom is very challenging.
It is challenging.
As all of
we
us.
don't realize, I think, what a machine we have here and how complex it is, right?
Well, considering the heart beats about 1 million times every 2 weeks, about 25 million times a year, that's 4 billion times in a lifetime.
My
And
word.
generally speaking, requires no service whatever. So it's a fabulous organ.
It's pretty amazing.
In
isn't
some
it?
cases
Isn't
it
that pretty
goes
amazing?
100 years, 5 billion contractions. So we're blessed.
We are blessed. We are blessed.
We stand on the shoulders of giants, which are our ancestors throughout the animal world as we ascended, if not descended.
Right.
So the next system of the heart we can think of is the muscle of the heart, and of course that's the powerhouse. The powerhouse doesn't work if it doesn't have fuel lines and if it doesn't have an electrical system to stimulate it. But the muscle is critical, and there are various organs that are involved in the muscle system.
Now, is the heart itself a muscle?
Well, it's not entirely muscle because it has arteries, it has nerves, it has valve systems, it has what one can think of as a skeleton, that there are rigid parts of the heart. It can't just be a jellyfish, it has to have a structure of its own. But it does collapse when it's not distended by fluid pressure, like so many parts of our body do. We're really water balloons distended by blood pressure, when the heart is the source of it. So it's not all muscle, but most of its weight is indeed muscle. Its function is to generate flow, and so you need muscle to have that
move
motion.
that blood through.
Yes, yes. So the next system of the heart is the valves, that we need one-way valves. If the heart simply contracted without one-way valves, the blood would go both forward and backward and achieve nothing. So we need blood to come in through a one-way valve, and then when the heart contracts, that valve closes and the exit valve opens, and allows the blood to move forward.
And through the rest of our body?
It does, but there are valves on both sides of the heart. The heart is really two different pumps. They happen to be appended, but they really work largely independently. So the right heart receives venous blood from the arms and legs, and it advances it into the lungs to receive oxygen. So when the right heart receives blood, it's more or less blue. We call it about blue blood because it does not have oxygen in it. And when the right heart provides flow, it goes out the pulmonary artery into the lungs where oxygen enters, and the blood turns more of the cherry red we associate with arterial blood, or if you see bleeding. Then it returns to the left heart to prepare to go out the aorta to the entire system of the body.
It is fascinating, isn't
It's
it?
very complicated, and if the valves aren't working, there are a whole constellation of conditions that can arise there. So we could talk about the various presentations of illnesses for
Yes,
these
that would
systems.
be
So certainly, perhaps the most common cause that people see a cardiologist is pain in the chest.
Right.
And there are lots of different sources of pain in the chest because the chest is a complicated area that we breathe.
There's a lot going on in there.
We breathe 15,000 times a day at least, so it's a very busy area. There's lots of motion,
Right.
and moving parts can develop aches and pains. So every time we cough, we generate enormous pressures inside the chest, which the ribs and the muscles and the structures of the chest have to absorb. So if we hooked up a water pipe to the chest, when we cough, we could generate 3 stories of flow popping up because it's a very large pressure. So it's not a surprise that the ribs hurt frequently. And really the most common reason that people present to doctors complaining of chest pain is arising from the bony cage around the vital structures, not the vital structures underneath. So rib pain is very common, and we usually are very honest and simply call it chest wall pain, whether it's the muscles between the ribs, the intercostal muscles, or the ribs themselves, or the lining inside called the pleura. The point is, it's not the vital structures underneath that cage, it's the cage itself.
So, pleurisy, is that, you just mentioned pleura, so is
Right.
that, if you get inflammation in that pleura, then
Absolutely.
you would get swelling or an irritation, and then you
Sure.
would get pain?
Pleurisy was a very common condition in perhaps the earliest 20th century. It's diminished considerably with our treatment of infectious diseases and pneumonia. So we don't see pleurisy as much, but we certainly do see pleurisy, and typically the pain is made worse with a deep breath.
Ah.
So we call any pain made worse with a deep breath pleuritic pain, and it renders very unlikely that the heart is a cause of that pain if it changes with the respiratory cycle, or with cough, or even with rotation of the torso, or if it's postural, that it made worse by lying on the left side or the right side. All of those things strongly suggest non-cardiac source.
But good to check out.
Absolutely,
Right?
absolutely.
To go and find out from a doctor
Right.
and not diagnose ourselves.
So if chest pain is highly focal, like the size of a few fingertips, it hurts right there, that's very unlikely to be the heart. Because the heart's nerves don't go right through the chest wall. They actually go back up into the spinal cord. And so when the brain interprets signals from the heart, it refers them to the chest wall, but it's not that accurate. So it's usually some nebulous pain. If you can say it's right there, very unlikely to be cardiac. It's usually a sensation where it's in here somewhere, but it's not right there. So a high focality of pain is a good thing in terms of being much less likely to be cardiac source. And then heart pain hurts more usually when you use the heart. So if you're up and walking, the pain is much more typical to be from coronary artery deficiency if it's made worse with exercise. And if it's the same both at rest and with exertion, less likely, not perfectly so, but less likely to be coming from the heart.
Really? Wow. So, so what do we have as far as the common diseases? Do we have?
Well, the far and above the most common with coronary artery disease is a deterioration of the interior of the artery that starts out as a yellow, fat-laden plaque, which is a disruption of the normal lining of the artery called the endothelium. And the trouble is that it itself doesn't cause a direct problem, but it has a penchant for ulceration. And when it ulcerates, then the blood flow sees tissue juice And like the Dutch boy with his thumb in the dike, it tries to plug the hole
So the blood cannot then move through?
so it doesn't leak out.
Oh,
The body doesn't know it's not a hole. So it simply recognizes these tissue juices, and if Mother Nature worked flawlessly, she would put a wafer-thin, paper-thin layer of clot over that ulceration, and all would be well. But Mother Nature commonly makes a mistake. And instead of that thin little layer, she makes an exuberant clot, closes the artery, and terminates flow.
Oh, and that's not good.
And that causes heart attack or myocardial infarction.
Oh.
It's a similar problem with stroke. So combating that problem is a major direction of public health, of striving to keep people healthy.
So that plaque, it seems like that it all starts with that plaque.
It does. It does.
So is there a way that we can prevent that plaque?
Absolutely.
I thought there might be.
And the good thing is it doesn't cost anything really to engage in healthful behavior. So the first thing is to strive to maintain an ideal body weight. That having excess fat tissue in the body promotes plaque formation. And we do that both with a healthy diet, which is mostly caloric intake. It's not so much what you eat, it's how many calories you eat.
Really? Is there a set amount, or a good amount for like men and women?
Well, it'll vary with the person, but the average person, if who's not particularly athletic, probably burns somewhere around 1,800 or 2,000 calories a day.
Really?
And we should all be conscious of calories when we look at all the containers of food that we're looking to eat. We should add up, and we should strive to be very conscious of calories, because some foods are wonderfully filling, very nutritious, and very low calories. And others are just the opposite, like a can of regular sugary soda has almost no nutritional value, but it's very heavy in calories.
Right. It's not a good thing for us anyway.
Right. The next thing is to not be a couch potato. We should spend at least 3 hours a day, 3 hours a week walking.
Okay.
Walking briskly is a good idea. Turns out that running extremely briskly is not helpful and may even be deleterious.
Really?
There's sort of a U-shaped curve that you have a high risk if you engage in no activity. The risk diminishes with mild to moderate activity, and it goes up again with extremely vigorous activity.
Wow. So walking is our best choice?
Yeah, walking, it turns out that weight bearing is the most important thing. If you
So
want
that
to
would
develop...
be like lifting?
No, just standing up.
Oh, standing
Bearing your
up.
weight in your legs. Doing what
We
we're
can all
doing.
do that.
Doing what we're doing doesn't burn many calories.
No.
But standing. And so gardening really has largely the same longevity influence as jogging.
Really?
Because you're on your feet. If you're on your knees, maybe not so much.
Right.
But you don't have to be an athlete, a jock, to promote longevity with healthful living, weight bearing, up on your feet and walking.
Now, what about the folks, and I know there might be some out there that have mobility issues. They might be in a walker, or they even might be in a wheelchair. Is there exercise that they can do that, I tell people when I do my talks, move however you can, because, if we don't move it, first of all, we lose it, and that is so true of everything. But we have to keep moving however we can. Am I accurate when I tell you that?
Absolutely. It's a huge issue, and so it's very hard to burn that many calories with the arms because our bodies weigh 120 to 200 pounds, and it's hard to do that kind of work with the arms. So we do what we can, but it's not going to be as good as if you're bearing body weight. So with a walker, people can still walk considerably, likewise with a cane. If they're unable to bear body weight, then it's going to be much more challenging. But accordingly, we don't have to get stout just because we can't burn many calories. We have to consume fewer calories.
Exactly. So if we're moving less, then we consume less.
Right, and some people think
You
that
don't have to be a rocket scientist.
I have
to
many
figure that out,
patients tell me that they're going to the gym and they don't understand why they're still overweight. And I allude to an automobile and putting gasoline in the car.
Mm-hmm.
So it goes in at about 4 gallons a minute. But when you're driving the car, it goes out about 4 gallons an hour. That's 60 times slower. So our bodies are the same way. A single candy bar can generate enough calories that it needs a full hour of vigorous activity to burn that off. And yet you can eat it in 1 minute flat.
That's for sure.
So the fact is, you can go to the gym all day and all night, and if you don't contain the calorie intake, you can get more and more heavy.
Oh, heavier even.
Right,
Heavier
right.
even. And that's frustrating. That is frustrating.
Very.
When you think you're doing all the right things and the weight is not going up.
Absolutely. And
Well,
people,
you know, folks, excuse me, Doug, we always go back to diet and exercise, don't we? Everything sort of stems around that, the healthy lifestyle.
that's how our biology evolved. It's only in the modern era that we've acquired this capacity. And I think a very intelligent way to assess this is that evolutionally, we evolved in a caloric deficient environment. Calories were hard to come by. And so we've evolved to survive that if we see calories, we should grab them and consume them as quickly as we can before something else or someone else does. We no longer live in a caloric deficient environment. We live in a caloric abundant environment.
For sure.
But no one reprogrammed us.
Oh.
So we have to resist a natural tendency to eat when we see calories.
And we eat for a number of different reasons, as we've talked about. But we have to modify.
We
Plain
do,
and
we
simple.
do. Right.
Plain and simple.
So those are the things we can do to reduce the likelihood of arteriosclerosis. And of course, deleterious habits need to be contained. Cigarette smoking is about the worst possible thing a person can do other than clamping one of their arteries with a surgical clamp.
So tell us why.
Cigarette smoking promotes plaque formation and it promotes plaque ulceration. And after
An
it ulcerates,
ulceration would be the hole or
breaking in the lining so that the body sees tissue fluid and makes a clot.
Okay.
It also promotes platelet stickiness and promotes rapid clot formation. So it's from multiple different directions. Cigarette smoking is very destructive and promotes coronary artery disease. So beyond its effects on lungs and bladder cancer, it's extremely
Not to mention
dangerous.
throat.
Right, surely. Almost everyone who has tongue and mouth cancer, it's related to tobacco.
Smoking.
Most of it. So staying away from tobacco is very important. You know, a fellow who has a celebratory cigar at a wedding is largely irrelevant. It's the repetitive striking of these toxic chemicals to our tissues that produces the deleterious effects.
You know, I know, and with all of the education and information that we have out here today, it always amazes me that people and kids are even starting to smoke.
Right.
It amazes me, but it's a fact of life. It does happen, but it's not good. And at these prices even,
Right.
forget the health part of it. I mean, people would be a lot richer in more ways than one.
Well, I think the key is to not make it cool or suave to be smoking. In our era, we grew up with the Hollywood stars all smoking on camera, and as children, we wanted to look as suave as they did.
And the Marlboro Man on the hill.
Right, but making it look like people with yellow teeth and yellow fingers and holes in their clothes and stinky breath, there's nothing so attractive about that. Not to mention the very sick people later in life from tobacco use.
I know, my dad he was a smoker. Everyone in my family was a smoker, not me though. But he ended up with cancer of the palate.
Oy.
And it just went downhill from there. So,
Surely.
you know, we can't avoid it.
The body doesn't have many spare parts. When we have to chop off parts, there's a permanent loss in most cases.
All right, we've learned to replace some, but not all.
And never as well as Mother Nature and our mothers made them.
For sure.
Right. So other systems that can go bad with the electrical system of the heart can go either too fast or too slow, or it can have lots of extra beats in between. So a very common reason that patients would see a doctor is they feel a thumping in their chest or a palpitation, and it reminds them of their own mortality, very justifiably. And so it's a frightful observation. And in many cases, these things turn out to be minor, but it has to be assessed. One can't say, I have palpitations, is it okay? It has to go into the details of the person's status. So palpitation is an abnormal awareness of the heartbeat.
Okay.
Whether fast, slow, forceful, regular, irregular. If you run up the stairs, it's normal to feel the heart. But it's not normal to feel it if you and I were sitting here talking to each other, to suddenly feel a thumping in the chest. So that would be something that would be worth assessing, and the thing that would make it emergent and very dangerous if it were obvious that that rhythm disturbance was causing a reduction in blood pressure. So whether the person gets confused or dizzy or faints or breaks into a cold sweat, these would all be issues that would make it urgent that it should be assessed.
So definitely 911 and get yourself to the hospital.
Surely. So if the heart goes too slow, and it's nothing that we're doing with medicines, the really only solution is a pacemaker. That's a pretty good therapy. It only takes a few hours to implant. The risk of implant is low. The devices are extraordinarily reliable. They last 5 to 10 years, so it's a wonderful therapy.
And can you do everything with the pacemaker that you could do without it? I mean, you can
Largely. The one thing we couldn't do until recently was have an MRI imaging, and now the devices are coming out with that capability.
Oh.
So it's very good. We wouldn't want people to do contact sports, but how many of us do that?
Right.
So that would be unusual.
Those days are gone.
Right. So the too fast heartbeat is usually more dangerous. It's very unusual to die of a slow heartbeat, but it's common to die of a fast heartbeat.
Is that like blood pressure?
That's the reason. It will drop the blood pressure. So if it's coming from the upper chambers of the heart, the atria, it's usually benign, doesn't kill anybody, but it can make them faint or uncomfortable and cause trouble, so it needs to be assessed. But very rapid rhythms from the lower chambers, the ventricles, are life-threatening and can be treated through a number of different approaches, but if it comes down, there's no other approach, we actually implant a device that will shock the heart if the heart is racing and it's in a dangerous zone of rate. That's called a defibrillator.
Oh, right. We know that term.
Right. Well, they were just being developed when I was in training, and now they're commonplace. Like most things in electronics, they started out on a wheelbarrow, and now they're about the size of this mouse.
Condensed
so they're
version.
Very tiny and extremely effective. But
Now, you know that we have, and I know there are a lot of people that have AFib, they call it.
yes,
And that is erratic
it is.
heartbeat. And is that...
That's the upper chambers.
That's the upper chamber.
So they would not get a defibrillator for that.
Okay. So the symptoms of the upper chambers heartbeat, are they the same as the lower chambers?
It can be. It's hard to tell without an electrocardiogram to determine where that abnormal rhythm is arising.
Okay.
But if it's atrial fibrillation, it's much less dangerous than ventricular fibrillation, which really is sudden death.
Wow, sudden death.
Right.
We don't fool around with that. Now we have about 3 more minutes. Is there anything else that you haven't covered that you might want, or any messages that you would like to, other than eat healthy, stay fit, exercise, and don't smoke?
I think we'll never be able to make parts of the body as well as our own natural biology. So the last thing we should do is engage in risky behavior that we say, well, I can get a coronary bypass, I can get a stent, I can get a pacemaker, I can get a new valve. It'll never be anywhere remotely as good as the original. So we should take fantastic care of our own natural bodies and not rely on medicine. Medicine is always a catch-up game. It palliates, it rarely cures, it delays the inevitable. So we're vastly better off with our own tissues.
So we definitely want to work proactively and take matters into our own hands, because if we do not, who is going to?
Absolutely.
Right? And we have to take charge. We are living longer these days, but we want to live better, don't we? We want to be operating under our own power, and having something replaced, as you've said, might be an answer to keep us alive, but maybe not the answer.
Right. And it's our mandate to teach this to the young, because it's those behaviors that they learn as young people that will keep them healthy throughout their lives if we're successful in teaching them these lessons.
Right, and we're a lot smarter, I hope. I hope we're a lot smarter these days, and we know a little more than we did years ago, and even when we were growing up.
We do.
You know, we are, I think, a little more aware of exactly how incredible these bodies are, and we must take care of them from the get-go.
We certainly must. And when worse come to worse, we all are going to get sick at one time or another. But we shouldn't hesitate to see a physician for something that could be related to cardiac disease. So it's a wide spectrum from palpitations to lightheadedness to shortness of breath to a chest pain syndrome. All of these entities really should be assessed by a medical professional and not hesitate, not hold off too long to pursue them.
So just before we close, or in closing, you're our cardiologist.
Yes.
And in order to get to see you, is it a referral from the primary care?
Yes. We want everyone to have a primary doctor because that person is really able to orchestrate all the players of the orchestra who care for the patient. So it's much better if they see a primary physician, and the primary physician can rapidly get specialty expertise as needed.
Well, thank you so much. I hope this has been enlightening for you. It certainly has been enlightening for me. Thank you so much for coming on board with us, Dr.
Thank you.
Risser.
It's very nice to work with you.